guys, welcome back to battlingpd.com. I'm Cindi Brasher. This is my husband Dan Brasher, and we haven't chatted with you in a few weeks. Sorry about that, but we want to talk today about the importance of developing a medical team, whatever your health crisis may be, especially as it relates to Parkinson's. Most of our journey has been a struggle to try to surround ourselves with the right team, people who are willing to look differently at Dan's symptoms, to consider different possibilities, to be willing to go a different way, to adjust medications. And as surprising as it's been for us to discover over the last 2 years, you may have to go through a lot of doctors to find someone who's compatible with you, not in terms of whether or not you like your doctor in general, but compatible with the approach you want to take to managing your health issues. And so Dan, a few weeks ago, came across an email that talked about the top 4 mistakes that doctors make in treating their patients. And we can relate strongly to 3 out of the 4. So Dan's going to share those with you today. He's going to talk about his own experience with you a little bit involving each of the 4. And I want to encourage you to, just because you've had a doctor for a long time, just because you like the style of their office or you like their staff, the people that surround them, if they're not meeting your needs, answering your questions, being willing to take different approaches to try to resolve your issues, it may be time for you to consider changing up your medical team a little bit.
Yeah, I had a primary care physician that I really liked, that I'd had for a number of years, that I enjoyed visiting with him, and we got along real well, but the problem that developed over time was that Cindi was noticing a deterioration in my physical condition that I wasn't noticing. And so as she brought it up, tried to bring it up to the doctor, he just kind of kept blowing her off. She would bring up symptoms that were happening in my life, and it seemed like no matter what happened, his response was always the same thing. Dan was just getting older. And eventually we were forced to pursue on our own an appointment with a neurologist so that we could get further answers. And I read the other week this article. It said there's 4 mistakes that doctors often make that hurt their patients. And number 1 is overconfidence. And it says studies show that doctors are often too closed-minded and not willing to consider alternative possibilities for disease. And we found that to be true.
Yes.
He's a nice guy, but he was so confident in what he thought that he wasn't listening to what we thought. We had a doctor's appointment this week in Atlanta that went really well with our neurologist, who's a specialist. He specializes in Parkinson's disease, and we've been with him for about a year now. And one of the things that really has impressed me about him is that whenever I go to my appointments, I don't feel like I'm going to hear what he has to say. I feel like we're involved in a collaboration. Mm-hmm. It's a collaborative effort. He wants to know what we're experiencing and what we think, and we want to know what he thinks about what's happening as well. And between all of us, we come up with what we really think is going on and the best approach to take on it. Mm-hmm. He's collaborative with us about my prescriptions, and that's really critical, because the first doctor that I was talking about, he left me on a prescription with propranolol for a number of years that eventually, one of the side effects that propranolol creates is it attacks your cognitive functions.
It can slow down your cognitive function.
And in my case,
certainly did with you.
It almost made me comatose. Mm-hmm. But the second mistake is patient overload, and I think these contribute to one another. Doctors nowadays have your family doctor is not Dr. Welby, MD, anymore. You know, it's not this nice guy that sits and talks with you and gets to know you and gets to know your family and is with you for a lifetime.
Right.
Patient overload is common. You know, doctors see you for they breeze in and breeze out just for a couple of minutes. And you know, the truth, we all feel ripped off because we're paying a $50 copay or a $20 copay, and the health insurance is paying $100 to $150 for that appointment, and you get 3 minutes.
Right.
And I don't care how much education somebody has, they're not worth $50 a minute. And so we feel ripped off often by doctors, but they're overloaded and often it's because of medical insurance restrictions that happen to them. But doctors, they said here, doctors can jump to incorrect conclusions because they don't take the proper time to stop and think clearly. I think our first doctor would have come to the right conclusions if he had stopped, slowed down, and taken the time to really think about the symptoms that he was seeing in me. If he would really listen to us. I think he was so busy thinking about his next appointment or the rest of his day that he didn't have time to really communicate. And communication means sending and receiving messages. And so we weren't communicating clearly with him, and he wasn't hearing us. And so because of that, he jumped to the wrong conclusions. The third thing is undelivered test results. And I got to say, we never had that problem, but one of the reasons for that is probably because we began to get aggressively involved in our own care. You know, as long as you don't know anything's wrong and you're not concerned about anything being wrong, you can miss things and even miss test results, and it's not a big deal. Once you begin to find out that things may be going wrong, you start to look closer at tests. But the fourth one is failing to revise the plan. And that's, again, this is why we're so much happier with the doctors that we have today.
Right.
I got a new primary care physician, and it's a lady, and she listens to what we say. She considers. I told her a while back that my goal, health-wise, was to come off of all my medications. Now, it doesn't look like that's ever going to totally happen. She told me recently because of the fact that I've had a heart attack and quadruple bypass surgery, I'll probably never totally come off blood pressure medication because blood pressure impacts your heart so much. But she was willing to listen to my concerns because propranolol had impacted me in such a negative way for so long. Probably one of the biggest improvements in my health came when we went off the propranolol.
One medication. So,
you know, it wasn't that I needed to be treated for something so much as I needed to come off of something. And we even asked our original doctor specifically, Cindi asked him, is it possible that any of the symptoms Dan is experiencing are simply side effects from some of the drugs he's taking and has taken for so long? And the doctor looked us right in the eye and said, absolutely not.
Right.
Now, if you think about it on face value, that's insane.
Right.
Because everybody knows there's no drug in the planet that you take that doesn't have some side effects.
Right.
Every time you get a prescription filled at the drugstore, the pharmacy gives you a list of the possible side effects so that you're aware of them. Now, oftentimes, we don't experience side effects, or we don't experience side effects for a long time.
Right.
Until we've taken drugs over a course of years. But every drug, there's no such thing as a drug that doesn't have side effects. It's not like eating an apple. There's no side effects for eating an apple. There's no side effects for having a glass of water. There's no side effects for having a glass of iced tea or eating spinach. But there are side effects. Every drug produces some side effect in your body eventually, if not immediately. And so when he said that, I should have right then stood up and said, it's time for us to make a change. But I didn't do it. I let the fact that I liked the guy impact us for too long.
Plus, I have to say that you were in a fog.
Yeah,
so
that's true.
You really weren't thinking clearly as you are today. The important thing for us is, having experienced 3 out of these 4 mistakes, is that Dan is better today. He's healthier today. He's stronger today, and he's clearer today as a result of the twisting around, the effort it took to meet with other doctors, discuss his health issues with other doctors, and taking the time to really develop a team. Dan now has a neurologist, very respected in his field, that is looking at his medications every single time we come into the office. He wants to know, when we made this adjustment, how did that impact you? How would you feel if we reduce this medication, and you track it over 30 days and see how that impacts you? I love having a team of neurologists and a primary care physician, and even a dentist, that allow you to collaborate with them as a team in regard to your personal health. After all, if you are not stewarding your own health, how in the world can you expect a medical team to do it for you?
The truth is, they're not going to do it for you. You've got to be concerned about yourself enough to examine what you're doing and how it's going. We've done this now for several years. It's taken time to get the right doctors.
Yes.
Everybody needs the right doctors. And if your doctors are not collaborating with you concerning your health and the medications you're on, then you're in a dangerous position. Mm-hmm. So I want to challenge all of you to go out and to sit down and ask yourself questions about your doctors and about their responses to you. Make these changes if necessary, because it can have a tremendous impact on the long-term well-being of your health personally.
So we've gone a little bit shorter today, I think, than we normally do, but this is our message. As I said, our toughest battle, our biggest journey, has been trying to find the right team of doctors to work together with us. And we feel like we've had a real measure of success here. And Dan and I are both pretty happy with what we've come up with. So we thank you for visiting battlingpd.com today. Thank you for spending a few minutes with us.
If you have questions or comments you want to make, we'd encourage you to go on the website and do that.
Yes.
We'll answer any questions that you might have in one of these upcoming videos. So tune in next week.
Thanks for visiting.
Yay.